President Cyril Ramaphosa announced the establishment of the Solidarity Fund on the 15th March this year. The fund is a public benefit organization established to confront the COVID-19 national crisis in South Africa. It is mandated to contribute towards the national health response, provide humanitarian relief, and mobilize South Africans. Last week, Ramaphosa announced the country is participating in the COVAX facility, which aims to ensure equitable access to the COVID-19 vaccine. Today, Thandi Nzimande, Solidarity Fund CEO, announced that the fund will release 327 million rands for an initial payment of the COVID-19 vaccine. The vaccine will cover 10% of the population, and the first delivery of the vaccine is expected to arrive by the middle of next year.
The Solidarity Fund is proud to be in a position to support government's efforts to accelerate the rollout of vaccines in South Africa, with a donation of 327 million rand to secure the country's position in the COVAX program. This particular donation is earmarked for the upfront payment required for South Africa to join the program and represents 15% of the total cost of securing access to vaccines for 10% of the population. That would be roughly 6 million people.
Since the onslaught of the epidemic earlier this year, the country battled with the shortage of personal protective equipment. This saw the Solidarity Fund approve 900 million rands to be allocated for the emergency procurement of PPE. And now that the country is faced with the second wave, the fund says it will have approximately 800 million rand to spend in phase 2, assuming no additional funds are raised.
The second big focus was supporting the delivery of care in the public hospital system, which, as you know, at the time we were all very concerned about the ability of that system to withstand a big surge. In the end, as I said, it has certainly done that, and it's well positioned to cope with now the second wave that we are all having to deal with. The mechanisms for supporting the public hospital system through the fund were firstly through the procurement of PPE. Thandi already mentioned this was the largest area of our support, approximately 900 million. We worked very closely with the Department of Health in understanding the needs and where the PPE was required.
As the fund moves out of the crisis phase, which is phase 1, into the living with COVID-19 phase, which is phase 2, it is anticipated this phase to last until there is a widespread vaccination and immunity in South Africa. Nothando Makutulela, SABC News, Johannesburg.